In this video, we will discuss prescription privileges for clinical psychologists. And so in chapter 1, we discuss some of the differences between psychology-related careers. And often it's stated that one of the key differences between psychiatrists who go to med school and psychologists who go to clinical psychology PhD, one of the big differences is the ability to prescribe medications. Because historically, clinical psychologists are not medical doctors, they cannot prescribe medications, whereas psychiatrists are medical doctors, they can prescribe. However, in recent years, this is starting to change. So there's been a movement since about the 1980s that has argued that psychologists should be granted the privilege to prescribe medications. And at present, this is now allowed in 6 states. So we have New Mexico, Louisiana, Idaho, Colorado, Illinois, and Iowa have all set a pathway for clinical psychologists to obtain prescription privileges. It is also allowed under specific circumstances in the US military. Because of this, we actually do have a couple of clinical psychologists in Hawaii who can prescribe, but only in a military context. And so there's been a number of pros and cons put forward towards whether or not we should allow clinical psychologists to prescribe. So I'm going to review some of the common arguments for and against in this video. And in this week's Laulima written post, I want you to kind of think critically about this and think about what your opinion is, as well as what the opposing side is. So some of the pros, so the arguments for prescription privileges. There is a shortage of psychiatrists nationally, and especially in Hawaii. So there just are not enough people available to properly prescribe and manage medications for mental health reasons. So the argument there is that we just simply need more people who can prescribe medications. A second reason is that clinical psychologists are arguably more expert in mental health symptoms than primary care doctors. And primary care doctors are prescribing a large percentage of antidepressants, anxiety medication, things like that. And so the argument here is that clinical psychologists are receiving training in mental health symptoms. And so they should be able to basically offer all the tools in the toolbox that can address those symptoms. Another argument for is the idea that there are other professionals who are not medical doctors who already have prescription privileges. So dentists, optometrists are 2 examples of fields that are not medical doctors, but that have kind of made a pathway for them to have prescription privileges. So there's already sort of a framework for non-medical doctors to have this privilege. Other reasons why it might be helpful, it's more convenient for clients. So if you only have to go to one office and you can get all of your needs met, that's going to be more convenient instead of having multiple providers trying to manage your care separately. People also argue that it helps the clinical psychology profession be more independent or autonomous. So what this means is, right now, if you're working as a clinical psychologist and you think medication is indicated for your client, you have to outsource, you have to refer them to another provider, and that's kind of limiting your professional autonomy. Another argument is that it helps with professional identification. So it helps clinical psychologists stand out as, we are experts in the mental health field and we are able to address mental health using all the tools in the toolbox. Along these lines, people argue that it's simply just an evolution of the profession. So clinical psychology has gone through a number of changes, and now that it's more common for people to subscribe to a biological basis of mental health concerns, clinical psychologists should be able to evolve the profession to keep up with that. And lastly, at a more basic level, it simply would be revenue for the profession. So clinical psychologists would be able to partake in some of the financial gains that other medical professions get from pharmaceutical companies and other developments such as that. So these are just some of the common arguments for why clinical psychologists should have prescription privileges. In terms of some of the reasons why they should not, there are a number of different cons. So first, there are training issues. So as it stands in a clinical psychology graduate program or internship or even postdoc, there is no built-in training for medications or other biological-based treatments. So there would need to be a development of some sort of way for clinical psychologists to be trained in pharmacology, biochemistry, all of the important background information it takes to safely prescribe people medications. A second con is that it could be a threat to psychotherapy. So if somebody is seeking treatment for mild depression, we know that there are psychotherapy tools that work, that don't require medication. But it could incentivize some practitioners to simply write a prescription instead of using maybe more time-intensive methods such as psychotherapy. There's also the concern of identity confusion. So, a psychiatrist and a clinical psychologist are two distinct career fields. And it's important for people to know that, a psychiatrist has a medical background, they are focused on the biological basis of behavior, whereas a clinical psychologist is more focused on psychological theory and mechanisms of behavior change. And by allowing clinical psychologists to prescribe, it could blur some of these lines. Another major con is the potential influence of the pharmaceutical industry. So in medical fields, this has been an ongoing issue of how pharmaceutical companies are allowed to market, incentivize, how they choose which drugs are sold to the public. And this would potentially, this would be a new development in the field of clinical psychology that we have not had to deal with so far. And lastly, there's just the simple research finding that medication might not actually even work more effectively than psychotherapy when we're talking about things such as SSRIs or antidepressants, or benzodiazepines or anti-anxiety drugs. The research shows that psychotherapy, works effectively to treat things like anxiety and depression. And so the argument can be made that medication might not be necessary and that it's important to have this distinct field that does not rely on medication. So these are some of the reasons why people believe that clinical psychologists should not have prescription privileges. So just to give you some kind of local information about this issue. So in Hawaii, we've had kind of multiple rounds of legislative sessions where psychologists have lobbied for prescription privileges. As I mentioned, we do have some prescribing psychologists in Hawaii, but they can only prescribe in certain military contexts. And so they have proposed a bill that would say that psychologists in Hawaii could prescribe if they met the following criteria. So they would have to complete an additional graduate degree, a master's degree in clinical psychopharmacology. They would then have to complete 400 hours of a prescribing practicum where they're being supervised by a prescribing practitioner, so probably like a psychiatrist. They would have to be supervised while they're treating at least 100 patients, so they could not work independently for the first 100 patients. They would also have to do 80 hours of a physical assessment practicum. And so this would be how to do kind of a basic general medicine assessment, which would be important for being able to monitor things like side effects or physiological changes because of a medication. They also included 100 hours of community service, and then ongoing 2 hours of supervision. So while you're a prescriber, you would have to meet 2 hours per week with a primary care provider or a senior prescribing psychologist to be getting supervision. So this bill did not pass, but there's still an effort to lobby for this. And this is pretty similar to what other states have passed. So just wanted to share this information. I think it's helpful to see what it would look like if clinical psychologists did get this privilege.